have a seat. Following our AUB alma mater, I would like to welcome everyone who is present here or who is virtually following us through our live broadcast for the 2020 Graduate Medical Education graduation ceremony. We're gathered here today to honor and recognize with joy and pride 125 young, bright physicians and one bright physicist who completed their training in the various medical and surgical specialties. Resilience defines you. This year carries different flavors and mixed feelings, pain and pride, sorrow and glory. We gladly recognize the tremendous support you received along the way. Friends, colleagues, family, spouses, they all shared the happiest moments and supported you through the difficult years. The group we are celebrating are well-trained physicians, fully dedicated to the well-being of their patients. They will serve the profession knowing that there are no boundaries to academic ambition and excellence. The advice I give you: help the needy and honor our humane mission. Don't allow the sectarian and political winds to scar your soul and make the colleague of today an enemy tomorrow. To all of you, dear graduates, congratulations. I am confident you make AUB proud. A new chapter starts today. Good luck. At this level, I would like to ask President Khoury, President of AUB, to address the audience.
Sorry, I have a muffled voice even with the mask on, so I'm going to, just while I speak, take it off. Congratulations, AUB, ABMC residents and graduates of 2020. You've walked through the fire, painful and formative as it is, of your residency and fellowship training. Today, you are well-trained physicians, women and men of substance, experience, judgment, skill. You're no longer training to be doctors or learning to be physicians. You are physicians. Your characters made more confident, your substance better formed by the arduous second leg of the long, long journey of medicine. Now you are ready to care more fully in partnership with other physicians for patients. But now, the full burden of patient care shifts to you. You will be attending physicians in less than 3 weeks, with all the rights and responsibilities that brings forth. Even those of you who are going to retrain abroad, let's face it, you are now attending physicians. I remember my residency training at the Boston City Hospital very, very well. My 3 years there were among the happiest of my life. They were mission-oriented days of enormous growth, confidence, and purpose. On my first Thanksgiving as a resident, not as an intern, but as a junior resident, that's what we used to call it, now you call it an R2, my fiance then, Lemia, and I invited a dozen of our closest friends so we could celebrate the opportunity to serve those less fortunate. And that's what you will do for the rest of your life. You will serve those less fortunate. That has been my purpose my entire life. That by then, I had begun to understand the skills necessary to achieve that. Those skills were starting to become a reality. If my residency at the Boston City Hospital contained many of my happiest days, then my fellowship in hematology and medical oncology at Tufts New England Medical Center contained most of my worst days. In addition to the fact that my father was rapidly deteriorating and approaching death due to a debilitating neurological disease, I missed the sense of purpose of shared struggle with attending physicians that I'd come to rely on and believe in during my time at the public hospital. The New England Medical Center is a great training hospital at Tufts University, but in my time there, it lacked that essential sense of mission. That is something that is not missing at AUB. It is here every day, and you feel it on every square meter of this incredible university and campus. In addition, the manifest deep divisions between world-class and world-renowned attending physicians and physician scientists made the atmosphere so joyous at the Boston City Hospital absolutely abysmal. But even amidst this misery, I learned, and even in your most difficult days, you've learned. I relocated that sense of confidence and purpose for my last year of fellowship at the New England Medical Center. And that subsequent momentum positioned me well for my career in academic medicine and my subsequent presidency at the American University of Beirut for good times and bad. And in the years to come, you will recognize that these days here as a resident, as a fellow, are what shaped you. And I'm going to argue that your years in medical residencies and subspecialties and fellowships, side by side with colleagues, helping heal the sick and tend to the least fortunate, when you recognize nurses as your full colleagues and partners, not as your subordinates, but as your partners, in the enterprise of the care of the sick, are as formative as any days you will have had since those first glorious 10 years of life when you were in elementary school. This is the cauldron. It's not college. It's not medical school. This is it. Now you know that there is no escape from the duty of care. So instead of shying away from it, embrace it. It will carry you through your greatest obstacles, your darkest hours, your most painful struggles. It certainly has for me. Reflect on that well, my young brothers and sisters. You have earned your place in the profession. From today onwards, you are not our trainees, you are our peers. Take the time to continuously hone your skills and characters. Now is the time to use them to save lives and minds. And never forget that your patients' best days are often worse than your worst days. But don't shirk the responsibility and the authority that come with that. Accept it fully. Let it wash over you and keep you humble, forever energized and committed, and always ready to serve those less fortunate. Congratulations, you're attending physicians today.
Thank you, President Khoury. I would like to call on the Interim Dean of the Faculty of Medicine, Dr. Ghazi Za'atari.
Good evening, and you must be very special today. You made history today because this is the first ceremony or graduation when everybody is wearing masks. So you're going to be making history of this medical school for years to come. Hopefully it will be the last year we will have this, but we'll wait. President Khoury, dear associate and assistant deans, Dr. Ghazal, Dr. Alam, Mr. Atay, my fellow physicians, congratulations on this landmark achievement to your careers. This is a moment that all of you and your families should be proud of. Your training has been a demanding challenge, and you have passed the test in glowing marks. Today, you are transitioning from a sheltered environment to a world where its realities are unfortunately harsher than earlier days and pose professional and financial challenges of an unprecedented magnitude. The primary mission of the profession of medicine is to reduce human suffering. So hold firm to the key and hardcore principles that you have been brought to adopt at AUB and its medical center during the many years of your training. Be a compassionate healer, and I emphasize the word healer because this is what our profession is all about. By applying the simple rule, which requires minimal but reasonable willful effort. Be good to others as much as you would like to see it applied to yourself. In your future practice, wherever is the next career destination, exemplify the highest levels of competence, character, compassion, trust, trustworthiness, leadership, professionalism, and community service. Our beloved country has been poisoned by corruption, lack of integrity, and unnecessary violence. And these have filtered partly into the medical community, have tarnished the profession. Therefore, for those of you who will be joining the workforce in the country, always work at sustaining the noble image of the profession, irrespective of the distractions and temptations. For the flocks of migrating fellows across the seas, be our good ambassadors by spreading around values indoctrinated in you and the skills you have acquired. Be inquisitive, challenge authority, seek new knowledge and experiences, and keep the homeland on your minds. Migrating birds invariably home back. In the midst of every difficulty, there is a definite opportunity for a better day and brighter tomorrow. We cannot resurrect a dead rose, but we can plant a new one. Life does not stop because of disappointments, and time does not halt if the clock stops ticking. The current pandemic has rekindled basic perspective on our life and has reaffirmed a long-standing notion that happiness comes by learning how to lead a simple life and be content with what we have. So move on with your lives and be happy. Your skills have been well sharpened and polished to be the competent and caring physician of the future. The world needs you right now. So go out and grab the opportunity that fulfills your ambitions and dreams. In conclusion, and on behalf of the Faculty of Medicine, I bid you a friendly farewell and good luck with your new endeavors. Thank you.
Thank you, Dean Zaatari. Now we'll be moving to the distribution of the diplomas. So we'll be calling on each graduate and respectively on the chair of the departments to present the degrees with Dean Zaatari. So we'll start with anesthesiology. Candidates who completed 4 years of training in anesthesiology: Dr. Layal Mahmoud Abu Dahir, Dr. Muhammad Ibrahim Ayoub, Dr. Jennifer George Hwayik, Dr. Adib Mustafa Awaidat, Dr. Bilal Muhammad Nadim Safi, Dr. Hussein Ali Talib, candidate who completed 1 year of fellowship training in cardiovascular anesthesiology, Dr. Amru Fawaz Izzat Khalili. Dr. Bassam Ahmad Farhad completed 4 years of training in anesthesiology. Department of Dermatology. Candidates who completed 4 years of training in dermatology: Dr. Tara Labib Bardawil, Dr. Samar Yusuf Khalil, Diagnostic Radiology. Candidates who completed 5 years of training in diagnostic radiology: Dr. Muhammad Ali Khalid Amin, Dr. Rayyan Sami Isa, Dr. Muhammad Fadil Sharif, Dr. Christelle Jean Tamer, Emergency Medicine. Candidates who completed 4 years of training in emergency medicine: Dr. Alain Eli Asmar in absentia, Dr. Ali Fadi Shami, Dr. Iman Hamid Shdeed, Dr. Muhammad Ghazi Anso, Dr. Dina Mawahib Mahmasani, Dr. Philippe Tony Zakhia Dwayhi, candidate who completed 2 years of fellowship training in emergency medicine administration: Dr. Nagham Antoine Fares, candidates who completed 2 years of fellowship training in emergency medicine education: Dr. Sandra Hanna Mrad, family medicine, candidates who completed 4 years of training in family medicine: Dr. Sarah Muhammad Baba, Dr. Rayyan Kamil Hmedi in absentia, Dr. Vicky George Qassouf, Dr. Hassan Abdussalam Farhan Al-Khafaji in absentia, Dr. Yusuf George Rizq, Dr. Rami Badi' Tarabay, Dr. Marielle Youssef Zouqi, candidate who completed 1 year of fellowship training in primary care sports medicine, Dr. Hala Sarkis Habib Ishaq. Internal medicine, candidates who completed 3 years of training in internal medicine, Dr. Mustafa Muhammad Ali Abu Hilwa, Dr. Fatima Bahij Allaw, Dr. Ola Kamil Asad, Dr. Ali Atif Atwi, Dr. Sana Ahmed Baddour, Dr. Alisar Marwan Shidyaq, Dr. Lodi Nicolas Shhadi, طلع له شهادة نيكولا. دكتور أحمد مصطفى أحمد الطراس، دكتور محمد عبد الرؤوف اللبان، دكتور ليال عماد الدين محمصاني، دكتور ولاء محمد محمود، دكتور أحمد محمد مصري in absentia، دكتور حسن محمود مخدر، دكتور جوزيف الياس الرومي، دكتور فارس رفيق السخن، دكتور يارا حنا يزبك، candidates who completed 1 year of training as chief resident in internal medicine, Dr. Sarah Jean-Pierre Abidoumit, Dr. Ahmed Khalil Berjawi, Dr. Jad Ghattas Mhanna, candidates who completed 3 years of fellowship training in cardiology, Dr. Zahi Talal Ibrahim, Dr. George Elias Al-Khouri, and the recipient of the Nail Al-Harith Fellowship Award, Dr. Ali Zghaib Zghaib. Candidates who completed 2 years of fellowship training in endocrinology and metabolism, Dr. René Fouad Houraniyi. Dr. Fatima Hussein Zarzour. Candidates who completed 3 years of fellowship training in gastroenterology, the recipient of the Shama'a Gastroenterology Fellowship Award, Dr. Maher Wasim Malaib. Dr. Nathalie Garios Ziede. Candidates who completed 3 years of fellowship training in hematology oncology, Dr. Yolla Gergi Haibe. Dr. Rola Muhammad Sayed. Candidates who completed 2 years of fellowship training in infectious diseases, Dr. Dima Musa Brahim. Dr. Mariam Khail Al-Quzah. Candidates who completed 2 years of fellowship training in nephrology and hypertension, Dr. Rose Mary Dawood Atiyi. Dr. Sarah Wissam Fakhruddin. Candidates who completed 3 years of fellowship training in pulmonary and critical care medicine, Dr. Maroon Jirgis Matar. Dr. Aline Talal Youssef. Candidate who completed 2 years of fellowship training in rheumatology, Dr. Hiba Muhammad Al-Rayis. Candidates, now we're going to move to anatomic pathology. So, Dr. Za'atari. Candidate who completed 4 years of training in anatomic pathology, Dr. Rayyan Muhammad Rammal. Dr. Mayal Fuad Saliba. Candidate who completed 4 years of training in laboratory medicine, Dr. Leticia Fawzi Daw. Neurology. Candidates who completed 4 years of training in neurology, Dr. Tariq Joseph Shdeed. Dr. Nasreen Mufid Ja'far. Dr. Muhammad Bassam Khudr Agha. Candidates who completed 2 years of fellowship training in adult and pediatric epilepsy and clinical neurophysiology, Dr. Mustafa Adel Ahtait. دكتور جواد محمد ملحم. Obstetrics and Gynaecology. Candidates who completed 4 years of training in Obstetrics and Gynaecology, Dr. Carol Elias Baraki. Dr. Muhammad Saeed Ihsan Al-Farran. Dr. Karam Kamal Hamid. Dr. Dalal Naji Kujuk. Dr. Marco Abdu Mwannis. Candidate who completed 2 years training fellowship in reproductive endocrinology and infertility, Dr. Sulaiman Samir Ghunaim in absentia. Ophthalmology. Candidates who completed 4 years of training in ophthalmology, Dr. Karl Jo Ziad Mhanna. Dr. Salma Walid Yassin. Otorhinolaryngology and head and neck surgery. Candidates who completed 5 years of training in otorhinolaryngology and head and neck surgery, Dr. Samer Nadim Abu Rizq. Dr. Gabriel Kudunya. Candidates who completed 3 years of training in orthodontics, Dr. Josephine Michel Bouairi. Dr. Sarah Joseph Khazea. Dr. Corinne Joseph Smaha. Pediatrics and Adolescent Medicine. Candidates who completed 3 years of training in Pediatrics and Adolescent Medicine, Dr. Reem Muhammad Abdel Nabi. Dr. Muhsin Nasruddin Abdullah Abu Al-Ala. Dr. Hanim Muhammad Al-Arab. Dr. Shireen Ibrahim Muhammad Ibrahim Awad. Dr. Majduddin Azzawi Al-Azzu. Dr. Marwa Bassam Bozainuddin. Dr. Yara George Isa. دكتور عمرو عصام درويش حسن الجهيني. دكتور ديما حسين حبنجر. دكتور ريتا ويليام صاروفيم. دكتور محمد خليل عمر تمر آغا. دكتور تريزيا الياس تنوري. دكتور زينب حسين الزين. Candidates who completed 1 year of training as a chief resident in pediatrics and adolescent medicine, Dr. Muna Najib Mahyoub. Dr. Mustafa Hassan Mustafa. Candidates who completed 3 years of fellowship training in pediatric cardiology, Dr. Maya Michelle Khouri. In absentia, Dr. Christelle Antoine Taya. Candidate who completed 3 years of fellowship training in pediatric hematology oncology, Dr. Dania Badr Tabush. Candidate who completed 3 years of fellowship training in pediatric infectious diseases, Dr. Yolla Salem Youssef. Candidates who completed 3 years of fellowship training in pediatric intensive care, Dr. Ghadi Butros Abu Dahir. Dr. Rami Nabil Sabuni. Candidate who completed 3 years of fellowship training in neonatology, Dr. Maryam Hussein Anqa. Candidate who completed 3 years of fellowship training in pediatric neurology, Dr. Nadia Muhammad Ali Laylat. Psychiatry. Candidates who completed 4 years of training in psychiatry, Dr. Antoine Eli Baino. Dr. Bernadette Ghattas Mdawar. Candidate who completed 1 year of training as chief resident in psychiatry, Dr. Evelyn Antoine Baroud. Candidate who completed 2 years of training in child and adolescent psychiatry, Dr. Zainab Khalid Bazzi. Radiation oncology. Candidate who completed 4 years of training in radiation oncology, Dr. Paul Sami Ramya. Candidate who completed 2 years of training in therapeutic medical physics, Ms. Jana Mushir Abu Zahar. Surgery. Candidates who completed 5 years of training in general surgery, Dr. Imad Ali Mqallid. Dr. Ahmad Muhammad Isam Los. Dr. Arwa Yahya Rifai. Candidates who completed 6 years of training in orthopedic surgery, Dr. Ali Hassan Artail. Dr. Tammam Sulaiman Hanna. Candidate who completed 7 years of training in neurosurgery, Dr. Ilyas Munir Ilyas. Habibi. Candidate who completed 6 years of training in plastic and reconstructive surgery, Dr. Reem Azzam Karami. Candidates who completed 6 years of training in urology, Dr. Muhammad Hisham Al-Hout. Dr. Ali Ahmed Mir'i. Candidate who completed 1 year of fellowship training in surgical critical care, Dr. Hamza Ali Raishuni. Candidate who completed 2 years of fellowship training in trauma surgery and surgical critical care, Dr. Ahmed Fawzi Kassab. It is worth mentioning, guys, that among the pride we have today and graduating 126 of our excellent trainees, among them there are 3 Army officers who came and trained with us to go back and join the Army. And at this moment, I would like to thank Dean Zatari, and we will be asking actually the president of the resident staff organization, a dear friend and colleague, Dr. Sarah Jean-Pierre Abidoumet, to address the graduates.
Good afternoon, colleagues. We are living in a time of great uncertainty and difficult challenges. Yet, with immense pride in our class of 2020, one thing is very much certain. You did it. It's finally here. Graduating in itself is a huge achievement to anyone who takes up higher education. And this year, the achievement is greater since the challenges were greater. This year, you graduated despite getting ill, despite maybe a member of your family losing his job, despite an economic crash, despite social and political unrest, despite the whole world going to a halt. All of this, in addition to all the things previous generations had to go through to get their degree. This year, you are fighters. This year, you are survivors. This is the year you finally become doctors at heart. Today matters for all of us and for all those who walk this journey with us. However, we remain focused on the future that you are very much essential in shaping and making sure we survive again and again. Hungry to learn and accomplish, we came to this institution with high expectations, and yes, AUB delivered. And we learned, and with our learnings, we will lead and create a better future for us and our families. I know that you have been passing through rough times, and a lot of us are dreadful of what this crisis is costing us and the hardship we are enduring. But I say, let us be appreciative of what we have gained out of it, the humility and the love of life. We have been immensely patient for a while, but today I am asking you to be impatient to change, impatient to live a full life, and impatient to give back to the world. We should use what we learned here at this institution and what we will learn along the way to make sure that you are ready to face a similar pandemic or even worse. As the saying goes, when your opponent gets tough, you only get tougher. Dr. Zainuddin, thank you for being a wonderful and inspiring mentor who time and time again never failed to prove to me and to all of us how much you care about each resident and their growth. Of course, the GME and the RSO cabinet members, thank you for all your efforts. Most importantly, when it comes to our beautiful families, the word thank you feels small. We were never alone in this fight. They might not be physically present with us today, but our families stood by our side all along the way. لن يمر اليوم كأي يوم عادي. أهالينا، حين كنتم تجلسون معنا على كراسيكم المعتادة لتشجيعنا وإرشادنا وتحذيرنا من مغبة العذاب والمر في الحياة، لحثنا على عمل الخير من دون مقابل. أنتم اليوم في المنازل تشاركوننا بهجة التخرج من وراء الشاشة. إن الحلم أصبح حقيقة. أشعر بدمعة الفرح. شكراً عائلتي الصغيرة، أصبحت عائلتي كبيرة. It might seem that nothing was supposed to happen the way it did, but maybe everything happened exactly the way it was supposed to, so that we can be the generation that defies hardship, the generation that defies inconvenience, tragedy, pressure, and despair. We are equipped with the blessing to improve people's life, so I ask you to embrace this blessing every single day. We know now, more than ever, that all lives matter, and we, more than anyone, can make a difference. Class of 2020, the pandemic class, congratulations on this unique achievement. Now let us go out, shine, and show the world what we are made of. Thank you.